It is time. 11:15, maybe a little bit before. We'll go ahead and start. So first presenting, Dr. Themis Yiaslas. Graduated with a degree in neurobiology, physiology, and behavior from the University of California, Davis. Is that a particular campus? University of California, Davis?
The main campus.
Okay, main
yeah.
campus. And completed his doctorate in clinical psychology at the PGSP.
Well, it's actually just changed to Palo Alto University, PAU, Stanford Psy.D Consortium.
Okay.
Nice and confusing.
Okay, got it. And as a clinician, he has primarily worked in behavioral medicine settings with Veterans Health Administration. Thanks for that. He is an associate clinical professor of cardiovascular medicine at the UC Davis School of Medicine, serving as a clinician educator, primarily training internal medicine residents in behavioral and lifestyle interventions, promoting heart disease reversal. His paper, Integrating Heart Disease Reversal Intervention, Blue Zones, Lifestyle Patterns, and Spiritual Practices with the Greek Orthodox Church Setting. Thanks.
Thank you. The late Father Thomas Hopko offered a scathing rebuke of those who misunderstand and limit the treasures of Orthodox spirituality and asceticism in the first chapter of his book, The Lenten Spring. How sad that people misunderstand the significance of the Lenten Spring. How distressing that so many take this time given by our God, the crucified Christ, as a season for sentimental devotions, anxious introspections, and pietistic pseudo-sufferings together with Jesus. And how depressing that others naturalize and rationalize the time with tepid explanations about the psychosomatic benefits of abstinence, with arguments drawn from one or another therapeutic theory. The Lenten Spring is welcomed by Christians in the Church not as the time for self-inflicted agony or self-improving therapy. It is greeted as the sanctified season consecrated to the correction, purification, and enlightenment of the total person through the fulfillment of the commandments of the crucified God. This excerpt alone had a chilling effect on me. And yet, nevertheless, in this paper presentation, I endeavor to integrate the ancient treasures of the Lenten Spring with a heart disease reversal lifestyle intervention. This excerpt encourages caution in understanding the true purpose of Lent. And while it does so, I think it is possible to promote the health of the total person through such an approach. So I'm here to step out of my comfort zone and share my ideas with you. I welcome your evaluation of its merits. My entire paper is about this one main point, that the ancient wisdom of the Orthodox Church and how it prepares people to meet the Lord's resurrection liturgically, sacramentally, and ascetically in communion with God and the body of Christ could provide a comprehensive framework and lifestyle within which to achieve the key objective criteria required for heart disease reversal to heal the body for a time, yet with even greater benefits for the whole person now and for eternity. So some background, because I know this can be an obscure topic. Atherosclerotic heart disease remains the most common cause of death, which is strongly associated with the Western or standard American lifestyle. Secondary prevention of subsequent cardiac events is an important goal in the long-term management of the disease, which cannot be cured. The standard of care for secondary prevention of atherosclerotic heart disease is cardiac rehabilitation. Cardiac rehab programs are typically anchored by medically supervised exercise and supplemented with efforts aimed at comprehensive cardiovascular risk reduction via smoking cessation, nutrition, stress management, and medication adherence. Yet overall, the participation in cardiac rehab is remarkably low in the United States. Eligibility for the program is also limited to the 1 year after a major adverse cardiac event like a heart attack, yet there remains the need for continued efforts for secondary prevention beyond 1 year, as atherosclerosis is typically progressive. So what about heart disease reversal? Among the most effective and well-researched lifestyle interventions is the Ornish Heart Disease Reversal Program, which is a multiple health behavior change intervention, or alternatively known as an intensive therapeutic lifestyle change program. The hallmark of this intervention is the explicit focus on targeting the causal mechanisms of atherosclerosis and using a direct measurement of plaque to confirm regression as the primary outcome. Despite being focused on disease, as its name implies, the Ornish program explicitly promotes whole person health and considers all of its components to be equally important: nutrition, exercise, stress management, and group psychosocial support. The efficacy of the program was established with 2 relatively small randomized controlled trials, including the Lifestyle Heart trial published in The Lancet. Ornish and colleagues then established real-world effectiveness through 3 large multi-site clinical trials, which are often forgotten, which together included 5,372 participants. One of these effectiveness studies found that those who were told by their cardiologist that they were eligible for an elective cardiac procedure, who then participated in the program, they found 77% of them had avoided the need for the procedure 3 years later without any increase in cardiac mortality. They didn't need it anymore. Despite the intensive nature of the Ornish program, which is about 8 clinic hours a week in person, or now in telehealth, the Ornish studies all reported high rates of participant adherence with percentages in the 80s. The strength of the research support is so strong that Medicare created a new category of reimbursable treatment, which they called intensive cardiac rehabilitation. One of the program's components, a strict whole food plant-based diet characterized by the consumption of whole unprocessed foods, including legumes, vegetables, grains, fruits, and small amounts of nuts and seeds, may actually be potent enough alone to promote atherosclerosis regression. Esselstyn and colleagues conducted a small, uncontrolled clinical trial that lasted 12 years, and among the participants, 73% had evidence of regression, and the other 23% had arrested the progression altogether. Clinical trials on this dietary approach has also shown benefits to those with type 2 diabetes, which is frequently comorbid with heart disease. And if you think about it, what the most common dietary recommendation for someone with type 2 diabetes is not this diet. So you can kill 2 birds with 1 stone, if you will, with this approach. The American College of Lifestyle Medicine position statement on type 2 diabetes remission recommends the pursuit of this objective via an intensive therapeutic lifestyle change treatment program that includes a low-fat version of this diet. So now to the VA in the program I created. The Ornish program and other similar programs were adapted for implementation into routine clinical practice within the Department of Veterans Affairs about a decade ago. VA HDRP is a 15-week interdisciplinary multi-component treatment that integrates the same 4 components of the Ornish program. It consists of an initial seminar, 3 individual sessions, and 12 group sessions run by the interdisciplinary team. Assessment and feedback on 25 different indices of health are given to veterans at baseline, 1 month into the program, and post-treatment. The key mechanisms targeted include maximal reduction of LDL, or bad cholesterol, comprehensive cardiac risk reduction, improvement of the gut microbiome and reducing levels of trimethylamine oxide, promoting the increase in endothelial progenitor cells, and optimizing the dietary sources of nitric oxide. The standard dietary approach in the program is this whole food plant-based diet, emphasizing nuts and seeds that are high in essential omega-3 fatty acids. The exercise component is a walking program, nice and simple, or whatever they're medically cleared to do. Stress management consists of a cognitive behavioral version of stress management training integrated with select positive psychology interventions, and lessons from the longest-lived people in the world, aka the Blue Zones, summarized as the Power 9, which I'll talk about momentarily, were also incorporated throughout. Inclusion and exclusion criteria will be discussed later when I talk about my idea of an adaptation of this program. Program has also been successfully delivered via telehealth for the last 5 years. So what's the rationale for integrating this sort of program into a Greek Orthodox church setting? Well, as a whole, church-based lifestyle interventions for reducing cardiovascular risk, including hypertension, has been shown to be effective. A deeper form of religious and cultural adaptation of health interventions, which has been defined as a faith-integrated approach, is where lifestyle behavior is inseparable from religious and spiritual beliefs, values, and culture. Several factors suggest culturally tailoring HDRP in the Greek Orthodox Church setting could be done effectively. Number one, the historical embrace of medicine, as is very well known and exemplified by this OCAMPR community. The ancient Eastern Orthodox Christian Church has long valued and embraced scientific medical practice. The Orthodox Church is likened to a hospital, with Christ as the great physician, and the first hospitals were created in collaboration with the clergy in the 4th century. The Pantocrator Xenon, or Xenon, I'm not sure if I'm pronouncing it right, is a well-documented example of one of these earlier hospitals. The hospital diet served was actually part of the medical treatment. It was documented as consisting of a balanced plant-based diet, consisting of 2 vegetable dishes with olive oil, 2 whole onions, and bread, and was unusual in that there was absolutely, quote, absolutely no meat or fish being served to patients. Thus, whole plant food nutrition was used to treat medical conditions and not only used as a form of spiritual discipline. A unique characteristic of these early hospitals, in contrast to other charitable institutions focusing on the sick at the time, was their commitment to the amelioration of disease and the restoration of health. This could be seen as being consistent with not merely wanting to slow down disease progression, but to endeavor to reverse it to the maximum extent possible, which is precisely the objective of HDRP. One of the most revered modern saints of the Greek Orthodox Church is Saint Porphyrios of Kavsokalivia, I think I said that right, who was known for his knowledge of modern medicine, the human body, and health. He described the Church's dietary fasting, which is, you'll hear soon, almost identical to this diet, as health-promoting instead of deficient and inadequate, as documented in the book Wounded by Love. All the books of the Fathers speak of fasting. They emphasize that we should not eat foods that are difficult to digest or that are rich and fatty, because they are bad for the body and for the soul. Meat is bad for people. Fruit and vegetables are good. You're not in danger of coming to any harm by fasting. No one has become ill by fasting. People who eat meat and eggs and milk products are much more likely to become ill than those who adopt a meager diet. This is an established fact and endorsed by medical science. Indeed, this is what doctors recommend. And not only do those who fast not come to any harm, but they are cured of illnesses. Another factor, the blue zones. The world's longest lived people during the last century were identified through the efforts of epidemiologists and the work of Dan Buettner, where 5 specific areas of the world were identified as blue zones, where folks were more likely to make it to their 90th or 100th year. These blue zones represent both unique lifestyles that have many areas of commonality and overlap. A central principle drawn from the research on blue zones is that they promote a cluster of healthy behaviors without health promotion or anti-aging as the goal. Numerous unique elements are identified as the likely reasons why these folks live longer, healthier, and happier lives. Now, drawing from the 5 blue zones, the common lifestyle elements were identified and summarized as the Power 9. First, move naturally refers to activity that's built into everyday life, primarily walking, and is supported by environments that gently nudge people into movement. Living life with purpose is central across blue zones, called Plan de Vida in Nicoya, Costa Rica, and Ikigai in Okinawa, Japan. Blue zones populations downshift every day, where they have routines to naturally reduce stress, napping in Ikaria, ancestor worship in Okinawa, and happy hour in Costa Rica. The 80% rule, where elders in Okinawa start by saying Hari Hachibu, which means to remind themselves to stop eating when 80% full, not to eat to fullness. The diet of every blue zone has consisted of some variant of what you could call a whole food plant predominant diet. Research has shown that the Icarian diet is a unique version of the Mediterranean diet in that it includes less fish and meat, while also including more chickpeas, legumes, whole grains, potatoes, and an extensive intake of wild greens, as a whole resulting in a greater emphasis on whole plant foods than other Mediterranean versions. Wine at 5 refers to moderate alcohol use. To belong to a religious spiritual tradition is important. Each blue zone does so, with Icarians in Greece belonging to the Greek Orthodox Church. They put loved ones first, emphasizing family, marriage, investing in their children, and keeping older people nearby or having multiple generations living in the same home. Lastly, finding the right tribe is the practice of building a strong social circle that often includes people who also engage in healthy lifestyle habits. Now, in Icaria specifically, the one blue zone where people are predominantly Greek Orthodox, the church liturgical calendar, feasts, and fasting periods have been highly influential on the population's lifestyle habits. Among the older generation of the longest-lived Icarians, we find evidence that during their early years of life, they ate a more predominantly plant-based diet due to poverty and need, with a large quantity of wild greens. Diane Kohilas, who is a famous person online, if you know who that is, quotes an older friend in this generation saying, "Weeds, weeds, weeds. That's all we ate." In contrast, consider that in the Western world, standard American lifestyle of the United States, research studies have shown that children by the age of 10 are already showing fatty streaks in their carotid arteries, which are the first stage of atherosclerosis. Through both an almost exclusively plant-based diet in their childhood, combined with a low total energy intake and a multifaceted, longevity-promoting lifestyle across their whole lives, we could conceptualize the Icarian blue zone lifestyle as a powerful example of primordial prevention of heart disease. In other words, preventing the development of the risk factors in the first place in the general population. In Icaria, the rest of Greece, and the Mediterranean, the traditional lifestyle is not just a collection of healthy behaviors. Identified as a UNESCO intangible cultural heritage, it also includes lived principles such as sustainability, living in rhythm with the seasons and the local climate, frugality, and conviviality. I love that word. The Mediterranean diet and lifestyle continue to be revered and a source of great pride and interwoven with Greek culture and the Greek Orthodox Church. I see the Blue Zone's lifestyle as representing the ounce of prevention and heart disease reversal intervention as the pound of cure. There's similarities, as I said, between this program's nutritional guidelines and fasting. It's most similar to the almost strictly vegan version of the fast. No meat, no fish with backbones, eggs, dairy, added oil, wine, except for shellfish. I think the overlap is one of the reasons why you see fasting associated with lower cholesterol, LDL, systolic blood pressure, and lower body weight. The VA HDRP program encourages the consumption of a variety of specific plant foods to ensure a balanced and complete diet. In that way, it differs. It also encourages a gradual reduction in animal foods and added oil while increasing whole plant foods gradually, which mirrors the Greek Orthodox fasting guidelines that we see during Triodion. In our theology of illness, pain, suffering, and illness have their origin in the fall or ancestral sin. Illness is not necessarily related to one's behavior or sinfulness, yet it can sometimes be the case. The spiritual meaning of illness includes providing the opportunity for spiritual progress or a manifestation of providence. Through the illness, one has an opportunity to develop patience. The Orthodox perspective of secular medicine, right, is one. It could be one means through which God may choose to provide healing, yet affirms that all healing comes from God. Another important view is that medicine, and by extension, all aspects of healthcare and psychology practice, can be the greatest expression of Christian charity and love. Now, while it can be a mystery to us as to why we are facing a particular illness, and we must maintain faith that all things work for the good of those who love God, there are examples when people receive blessed reassurance that their trial has deep spiritual significance. One powerful example of what are usually the unknowable ways that illness is part of one's salvation comes from the life of St. Paisios of Mount Athos. A man with a chronic neurological syndrome with ataxia who was paralyzed and wheelchair-bound sought the counsel of the saint regarding whether to seek medical treatment in the United States. St. Paisios is quoted as saying to the man, grabbing his legs, "These little legs, they're going to take you to paradise, and you don't realize it." After helping the man walk on his own feet, itself a miracle, St. Paisios tells the man that God will not heal him, but is asking him to bear his illness because his caregivers around him are being saved in addition to himself without realizing it. This example also reveals important aspects of the Orthodox Christian perspective on health-related miracles, which is that God enacts miracles for our spiritual benefit. Miracles are always in the context of God's profound love for us, and that healing of a medical condition in and of itself is not always what is good and willed by God. The miracle of the paralyzed man walking perhaps helped that man to have faith to bear his cross while his medical condition remained. So, one could conclude that facing one's severe heart disease, making efforts to change lifestyle habits, including those that are of sufficient intensity to promote reversal of atherosclerosis through a program like HDRP, could simultaneously be a part of the synergy between God and his own or their own efforts, potentially being a part of a pathway to deification for themselves and those around them. The Greek Orthodox adaptation of HDRP. Let me try to summarize. How am I doing on time?
You're at 20 minutes.
We have questions.
Okay. Who's it good for? People that are told you have a blockage in a place that is not amenable to stenting or bypass surgery. You're going to feel your symptoms. Medicine and lifestyle are your only options. People with chronic angina also benefit because you experience symptom relief rather quickly. That's why this approach really is what it is. It's not really tailored to the general population who feels no different when they eat a hamburger or when they eat beans and rice. Someone from the clergy, a psychologist, a dietitian, a pharmacist, and tapping into the local parish are the people that deliver. Virtual delivery. This is a unique area of expertise. Probably need to do it virtually so that these sessions can be run by the very few people who know what it's all about. And then interface with local parishes to help connect them with what exists already. That's the thing that I love about it. Cooking classes and social engagements and all. The whole life of the church is there already. It's just about interfacing. The interdisciplinary nature of it is amazing. When I work with other folks, pharmacists, dietitians, and others, and we're doing this program together, we're learning from each other. I already know what they're going to say when people ask questions now because I've heard them answer them for 10 years. Imagine what would happen if, as a psychologist, you're presenting something about cognitive distortions from a psychology perspective. And then the clergy in the room also they start talking about the difference between, the kind of sadness that is positive versus the kind that leads to despair. Now you're having, in real time, without needing to coach each other up, you work together for the good of the people. If you want to know what the program is, I published an article in the American Journal of Lifestyle Medicine in 2024 that lays out pretty much everything about it. I think the most important thing here to say is that it maps on to the church calendar. Triodion maps on to the prep period that we do for people. Great Lent represents the early phase of figuring out, is this going to work? Is my cholesterol going to change? Is my angina going to clear up? And then after that point, which is about midpoint in Lent, it's about maintenance. All the way to Pentecost. So it's longer than what I have in my article, what I normally do, with the idea of creating a longer ramp for integration and maintenance. I think I don't really need to tell you all the rest that I wrote, even though I love it. Maybe I'll just end with the final thought. Perhaps this intervention would detract from the objective of Great Lent to be set apart for complete and total dedication to the things of God. Yet for those with chronic disease, they cannot stop attending to chronic disease management. They can't just ignore their chronic angina pain in order to focus every ounce and energy to God. So the intervention infuses Orthodox Christian perspective on health behaviors, making them have the potential for increasing the devotion and attention to God, increasing motivation for healthy behavior, deepening one's relationship to God, and in an ideal sense could support one's effort to grow into the likeness of Christ. Questions? Yes.
Thank you for your very strong interdisciplinary approach. In your experience, have you found that for lack of a better word, I'm gonna say there's a detox period in like if people are predisposed to those salty potato chips versus, the greens, is there a time where like people don't like the greens, but then they get used to the greens, and then if they have the potato chips, they get like kind of grossed out?
100%. I mean, it just mirrors probably what any of you experience in your own work if you do this kind of work. I will just say that something that I think is unique to the approach is the sort of all-in mentality. So that's even modifiable. We don't tell people you have to do it exactly this way. They kind of determine their on-ramp. But for some people, the slow method is worse. They never really lose the taste for certain things. They keep wanting. It's kind of a paradox. But I mean, anyone who's engaged in fasting realizes after a while you feel light, you feel good, you feel bright. You don't want the same things. You're like, I don't even care if I have it. You have a hamburger and your stomach kind of feels like, ugh. That's the benefit of this kind of all-in approach. It starts to support itself. Whereas if you're constantly having the things that you're avoiding, they maintain that power. And so, yeah, we've got to work with that. But there's ways in which the standard method, I should say, tends to work some of that out. Yeah.
Did you ever consider thinking about cancer world and the diet? We have at Stanford, I work at Stanford, we officially have cancer preventing diet, which is so almost identical to what, and we offer this diet for patients who had breast cancer and in the stage of remission. And so it also has the component of preventing reoccurrence of breast cancer, which is, we have articles on that. And so what are your thoughts?
You go. Great work. I wish you the most success. I think in general, when I started at least, I was advised to not enter into the cancer world too directly, just because people have mixed reactions, especially when you use words like a reversal. In many cases, right, it's concerning, right? Is this the snake, another snake oil kind of thing that's being used to manipulate people that are facing a life-threatening illness? I had to cut a lot out of this paper, but I had stuff on Ornish. He adapted the program for people in watch and wait, low-risk prostate cancer, showing evidence of reversal of that and stabilization. Breast cancer being another one of those that's impacted by lifestyle. It makes a lot of sense. And sure, it could be, this is just an idea now, but the idea of even expanding an adaptation within the church that's more cancer specific, be amazing. You should do it.
And another question, very quick: how do you manage as a team that initial transition to this diet when it's really difficult to let hamburger go and oil foods go? Do you convince people? Do you have someone to help you to help the patient?
That's why we get our salary. We have to help them. But I think if you want to consider it, right, one is just even the branding. People are you telling me if I do this amount of work, I can turn back the process a little bit? Okay, I'm a little bit more motivated. And then the seminar, it's well crafted at this point. We have images before and after regression of atherosclerotic plaque. We have, we talk about all kinds of amazing things that many people don't realize. People don't realize that their stents can get clogged. People don't realize that bypass arteries last only so long, and they clog quicker. So we talk about that. We say, you have a stent today, you have not changed your likelihood of a heart attack down the road. And their eyes get like this big. We also talk about the effect of lifestyle on sexual health. And so to be perfectly honest with you, I can't imagine another thing that's more powerful other than what I just said than talking to people about the potential to address things like vasculogenic erectile dysfunction. The idea that you can actually improve functioning in that area, even a little bit. They're sold. And the all-in nature, the hardest part is that it takes elements of what somebody might do in like a 1-month fad, kind of jump in, and we try to prevent it from ending. We have to transition them from this all-in approach where they experience dramatic change. They recognize, hopefully they see symptom improvement. They go, I feel better doing this actually. I don't feel worse. I don't feel deprived. I can go walk up hills now, and I can do all these different things. Then it starts to transition. How do we make this a lifestyle? So after the first set of labs, the 1 month follow-up labs that we have people do, the question then becomes, how can I enjoy this for the long run? And we just extend it out. It's not for everyone, though. I think that's something that I probably should say. For some people, they hear this and they go, never me. That's okay. I don't view it as the one and only kind of thing, but for some people, especially those with symptoms, I think it's a great option.
Question, one more question?
Okay.
Sure. Yeah.
Somebody else have one? I think it's you.
I have one, but I'm worried it's too big of a question.
I have one you probably get all the time. Of like the big four, vegetarian, vegan, paleo, carnivore, super new, very well supported by younger generations. Is there any well-supported research that zeroes in on the type of meat these communities are, or is it always the standard American diet quality of meat? And does that make a difference?
I mean, in what I do, I don't specifically zero in on that because we're deliberately asking folks not to have any, no meat, chicken, fish. I do think it's clear that there's a difference. Processed red meat, is different than fish, but then it can get complicated quick. One thing that I didn't say here under the dietitian section is that we are explicitly not a vegetarian or vegan program. That point is hammered from day one. I have a room full of veterans, Vietnam era, Agent Orange exposed, service connected for conditions related. And people say, listen, doc, I'm a carnivore. You're gonna make me a vegan. And I said, that's not what we do. I don't identify as a vegan. So identity issues are actually massively important. We basically say, you're gonna become more of yourself than you thought you were able to be, and you'll be enhanced. You're not gonna adopt someone else's identity. And that's not just veteran, combat vet, military, that's also Greek or any other kind of aspect of culture and identity. You're gonna be more of yourself. You're gonna choose to do this because you want the outcome. And the modifications to it are likely gonna be driven by how do you maintain you? And that's good. So, the one thing that we evade mostly is arguments about diet, the diet wars. I just say, look at these are all the randomized controlled trials, the effectiveness trials. These are all the reasons. This is a Medicare-approved intensive cardiac rehab version. If that's not enough for you or you're not into it, that's okay. There's other ways to do it. No one has proven themselves to be the best. So, sorry, I don't have more specifics, but yeah, we don't even use any V words in the program. We wouldn't even utter the word vegetarian or vegan. Nothing against those groups. It's just we're trying to remove barriers from people's success. That's it. But we have vegetarians and vegans that come in, and what's funny is their cholesterol plummets like crazy too, because they have so much oil they're pouring on everything, coconut oil. And like, why is my LDL so high? And I mean, I've looked at labs 3 times within a 3-month period on the same people, hundreds of people at this point. So it's almost like a lie detector test. I can see almost exactly what people are doing. And it's both, I wouldn't call it a confession, but it's a way of honesty that feedback is also powerful on the other way. They go, wow, I did this and this is the impact. So anyway, I don't want to go on any further than...
We've got a couple of minutes if you want to take a shot at it.
I was wondering what your thoughts are on the GLP-1 medications.
Case-by-case basis. They're great, and our dietitian and physician that we work with, try to talk about that and make sure people realize that they might need to make certain modifications. Which I think that's maybe you're bringing up a good point, right? So we don't take over medical care in this idea, right? They're still treated by whoever their team is. And if their team doesn't medically clear them for something, or if they give them some modification for activity or even related to medication, we honor that. And so the only issue that might come up is if there's too dramatic of a difference between one group member and another. Sometimes we've had people come in, and I wrote a medical humanities essays about this, about somebody who used to always introduce themselves as, hey, listen, y'all, I'm a carnivore, and he was eating meat all the way through the program, and everyone in the group was just looking around like, this is the only one who's not following the program, And then he just did it in the end, and of course, the rest is history. But my main point being, it's about maybe the way the group works together. Nobody seems to mind if someone says, yeah, I'm on a GLP-1 inhibitor. But like big differences in the diet, like carnivore diet versus what we're doing, right? They don't tend to gel.
I was just wondering if you've noticed that people are able to adhere to the diet better because they're on the GLP-1.
I don't think we've had enough people to say that. Yeah, I don't know if that's true. It's possible, right? Especially if there's folks that are getting less food noise or the things they want to avoid. I think there's been some concern around what was like protein intake and things like that. So, because we're not dogmatic in the sense. We're essentially saying do the Greek or the Eastern Orthodox diet or fasting approach. But we're just adding another layer of thinking, are we above a certain threshold to make us think you're likely to have the best impact on atherosclerosis?
Another round of applause for